Guys, welcome back to Medical Coding with Blue. Today's episode is all about I am applying everywhere for a medical coding job, but I'm still not getting hired. What should I do? If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I've given my advice plenty of times on my channel, plenty of times. But I'm going to read this particular comment because there's a few things that I want to touch on in here. And maybe if you're running into this problem, hopefully you'll get this message. Okay, so here we go. So the viewer says, and thank you to the viewer who made the comment, I'm currently on the job hunt for a medical coding job. Depression and anxiety make it hard to stay positive with the large influx of rejections, but I'm still applying with reckless abandon. One of the issues I'm running into while applying is not seeing my certification listed and not being able to continue with the application. And then I said that I would do a show about this. And then they said, that would be great. I got my certification through PMI myself. And from what I saw, their certification is one of the harder ones to get. It is equivalent to the CCP. But I don't want to lie on the application saying that when I technically don't have it. Okay, so first of all, two things. I have no idea what PMI is, and I have no idea what a CCP is. That's first of all. Second of all, the thing that got me the most was when they said they were applying with reckless abandon. When you're out there and you're applying for a job as a brand new medical coder, everybody wants experience, but how are you supposed to get experience if no one will hire you? They will hire you. And I've mentioned several times to get registered with a temp agency, and a temp agency is not going to give you a one-day assignment for medical coding. They will give you it's typically going to be like weeks long. Sometimes it's like 90 days. Sometimes it's like 6 months. Because these temporary agencies in your area, you can Google temporary agencies for medical professionals, and typically a lot of them will compete for medical coding contracts or other projects that need help. And so that's how you start getting your experience to add on to your resume, okay? So that's the first thing that you have to know. But before that, you have to be very deliberate about where you are applying, number one. Number two, you have to have that shown on your resume. For those people that think, oh, well, I'm just going to write this resume and I don't really, have a good grasp on what this resume needs to have on it to get attention. I'm just going to throw out a bunch of resumes wherever somebody bites and that's where I'll apply. Employers know this. They know somebody who is being deliberate with applying, and basically when they're applying, their resume, their cover letter is stating the job title that they're applying for. They're not just using some generic response like seeking entry-level medical coding position and that kind of thing. If I'm a hiring manager and I see something like that, I would be like, no, this person's immediately rejected because you didn't pay attention to what it is that we're looking for at this facility. So if you are not doing that, if you are not specifically stating on the resume or the cover letter the specific job title that you are applying for at that place, that's mistake number one, okay? And number two is that you have to have a really good resume and a really good cover letter. Let me explain something about these resumes and cover letters. A cover letter is looked at. For those of you that say, oh, well, I heard that you don't need it. You do, because the cover letter is the personable letter to that employer saying, this is what I have to offer. It is not a regurgitation of your resume because they have your resume, right? Your cover letter is going to be that draw. It's going to be that thing that brings the people to say, you know what, I want to talk to this person. The cover letter is going to have your soft skills, that you're a people person and that you're organized and that kind of stuff. That organized, team player, smiling face, that should not be on your resume at all, under the skills or nothing. I don't care. If I'm a hiring manager, I don't care about all that. That to me, when I see that, is somebody wasting my time, because when I see skills for a new person, I want to know, what were you trained in the school? Because that is your skill now. You don't have experience, but that is your skill. So listen carefully when I say this. When you are trained in ICD-10-CM, ICD-10 PCS, if you had that. If you didn't, it's okay, because that's on the inpatient side. Some people get that training and some people don't. But if you did, and you feel comfortable with doing that, that should be on your skills list. And it should be written out ICD-10 CM or ICD-10 PCS, right? Because if you're putting ICD-10 CM/PCS, again, lazy. That's lazy, and I would reject that, okay? So it's all about the details, guys. You have to pay attention to details. It's not about just throwing out your net just to see what you catch, because then again, you're not being deliberate with your actions. CPT, HCPCS level 2, what else did you learn in this school? Okay, that's what you need to put on your skills list. And I've said it so many times, guys, all the skills that you need to have on my resume tips videos. Okay, so that's something that you can look at to ready your resume. And please don't complain that, oh, I didn't work in anything that was medical related, so I don't have any transferable skills. I bet you do. If you worked in any place that you had to protect private information, that should be on your resume as a transferable skill. If you are saying that, oh, I ran, let's just say, PMC reports. What the heck is a PMC report? I don't know what a PMC report is. Do I care what a PMC report is? No, because that's not telling me a skill. Now, if you said I ran reports for customer information on orders with, and then you can say, well, with, I'm trying to think off the top of my head, but with their name and their order number and the date and things like that, it was organized and I made sure that everything was entered in properly. Now we're talking, because you said, oh, that you were running this report and this report has all this customer information on it. Okay, these are private things that you're not going to go share with everybody willy-nilly, right? Because like maybe it has the address on it, or maybe it has serial numbers or whatever. So those are the things that it would be better detailed there. But you have to be to the point. You can't say all the things that you did. And if you have like paragraphs for the things that you did for a job, that's a no-no too, because I'm not going to sit here and waste time reading a paragraph. Bullet points, guys. Bullet points. That's what you want when you're writing out your resume. Now, yes, you can farm your resume out to a resume writer. There's a ton of resume writers on LinkedIn. I am a resume writer myself. However, currently my calendar is closed until August the 15th, 2023. So if you want to get with me by then, that is totally fine, but I will not be booking until after August the 15th, 2023. Okay. But with these resumes and cover letters, guys, this is what's going to get their attention. If you have a poorly written resume, it's going to be harder for you to get attention, because it's going to show like you're just applying anywhere and everywhere. You want to be deliberate in the things that you have there. If you have your certification, then everybody knows that when you have professional correspondence that you put, and you have your credentials, your medical coding credential, whether you have one or two or more, you put that on your name. Okay? If you were to just put your name at the top and then all of your information, your address, I don't know if you're certified, right? Are you certified or not? And this PMI, I don't know what that is. I don't know what CCP is. And they heard, or what they saw, that it's harder to get. There is only one medical coding certification that is truly hard to get, and that is the CCS, because that is a Mastery Medical Coding certification. Now, all the medical coding certifications are difficult, but the CCS has a very special place at the top, because it is the mastery of inpatient and outpatient coding. Again, don't get offended, but I'm saying every test is hard, but that CCS is the hardest, okay? That is the gold standard. And I don't say that to scare folks. Please don't tell me you get scared because I said that. I'm saying it so that you're prepared when you go, because sometimes people underestimate these tests, particularly with the CCS, and then they're just like, why did I fail? You failed maybe because you didn't take it as seriously when you were studying like you were supposed to. I don't know. You know what I'm saying? So that's something that you have to think about when you're thinking about which certification to get. But when you have your resume, your credentials should be on your name. There is no excuse unless you are not certified. Now, what the person says at the end, I don't want to lie on an application saying that I have that when I technically don't, because they're saying that they did this PMI program and that it is harder to get, and it's equivalent to the CCP. If you were to say, I don't even know what CCP is, but if you were to say I have the CCP and you don't have it, they're going to find out. So number one, you just lied. Never, ever lie on your resume. It has to be everything that is true. And it has to be everything that can be corroborated or backed up with some evidence, because they are going to run a background check on you. And that includes verifying your credentials with the association. They're going to see, is your credential still valid? Are you still okay with the association? So that's what they're going to do when they have that out there. And for those of you who have the CPC, and right now you have the CPCA because you're brand new and you think, well, maybe I won't put the A on there because nobody seems to want to hire a CPCA. They do hire CPCAs, guys. They do. Well, maybe if I just leave it off. Don't leave it off. If you are a CPCA, you have to designate yourself as a CPCA. Medical coders and the health information industry, we pride ourselves on ethics and adhering to those ethics. So we have to be truthful and honest. So if you are a CPCA, you need to identify yourself with your credential as a CPCA, okay? Same thing if you have the CCA or the CCSP or any of those, the CCS, you have to make sure that you put that on there. If you have your RHIA or your RHIT, everybody knows RHIA or RHIT, if you have either one of those go first, then your medical coding certifications. And that's the way that it goes. That's the order, okay? Typically, it's the one that's like, if you have the RHIA and you also have the CCS, RHIA, CCS, because the CCS is right there. It's the mastery. But the degree designation is going to go first, okay? So I'm just saying. But that's what you have to know, guys, when you're doing this. It is about etiquette. There is a thing when you're applying to these jobs that you're not going to sit here and put out just a blanket, form letter basically to everybody trying to get in, and then have the nerve to get frustrated because no one's calling you back. No one's calling you back because you're not doing the effort to say what it is that you can offer, or what are you looking for in this particular facility, because sometimes facilities will have several different positions listed and multiple positions for medical coders. Sometimes they'll have a professional fee coder. They will also be looking for a same-day surgery coder. Some will be looking for an outpatient clinic coder. Some will be looking for an inpatient coder, somebody who can code on the for the facility side. So that's something that you have to know, guys. They're very specific in these job titles. So if you're just throwing out these resumes thinking that, oh yeah, somebody will pick me up, you need to rethink your approach. And for some people, they say, well, I have anxiety and I have depression. Everybody is going to get the rejection. Everybody goes through that. No one is immune unless you know somebody, right? And even then, you can still know people and still not be able to get in. You know what I'm saying? So it's not about, oh, it's because you're connected. It has nothing to do with that, okay? And it has everything to do with, you have to keep your eye on your goal. What is the goal? The goal is to get a job. And so you have to put aside all of these other things in your mind. Well, I have this depression and anxiety and it's just bringing me down, because it would bring anybody down. Not just having that. People who don't have that would still be brought down, being rejected all those many times. But that's why, again, you have to show that you're serious, because there's a lot of people out there, guys, I'm going to be honest with you, that they expect to graduate from these programs and immediately get into a job because that's what the school promised them. But then the reality hits that they get out into the real world, and there's like everybody wants experience. This is what you would see beforehand if you did your research, right? If you're looking at those job listings, you would see that they want all this experience. And then when you see that they want experience, then that's when you go and do your research. You find my channel where I explain that you're still going to apply anyway. Now, if you have a certificate that is not a one of the four main ones that employers are looking for, the CCS, the CCA, the CCSP, or the CPC. These are the four main ones that medical coding employers will look for. If your credential is not one of these, if it's one of these weird ones that are, by some unknown organization, that may be part of the problem. But it doesn't mean that you can't take one of these four credentials, right? Because none of these four credentials requires you to go through a formal program. And people will still tell me, oh no, Blue, it says you should have experience. It's not required, but it is recommended to have experience, of course, because again, these credentials mean business and they want to set you up for success. So that's why they say those things. But again, guys, if you are taking the time to really do your research into the industry and know what you're stepping into, you're not going to run into this issue. And it's not about feeling sorry for yourself or, throwing a pity party, guys, because it's going to take a tough skin. And I know I probably hurt some people's feelings with that right now too. Oh, well, why would you say that? Everybody goes through this. And you have to have a thick skin, because once you do get into the real world and you get in with these doctors and these other medical coders, you just wait until you have to explain yourself in an audit to a veteran auditor, medical coder, and you may be right, but now you have to explain this to a veteran who may take it personally that this new person is right, because not all people are evolved when it comes to professionalism and how they handle things when there's discourse back and forth, right? When you're talking about why you thought it was this versus what they thought, okay? So you have to be able to be strong enough to say, I coded it this way because of this guideline, this rule, this passage in the coding manual. You have to be able to defend yourself. Okay, that's very important. So again, if you allow yourself to be just pushed around, oh, well, they said that it's this way because they're the veteran coder. If they're not telling you why, then you should ask why. Because then that's when you say, because according to this official reference, this is the way that it's supposed to be coded. Why is it this way? And they should be able to explain that to you. But again, it's about having a conversation. It's not about being confrontational. It's about having a conversation. So that's something that you have to get ready for. And then wait until you have to talk to a doctor who is going to refuse to do anything that you say, because every medical coder is telling them something different. Wait till you see that point. And when you do, it's on you to say, okay, well, I'm going to have to work on teaching adults, because we all have to do that eventually, right? If you are a really good hands-on medical coder, you will be active in the teaching. You won't wait and rest on your laurels that somebody else is going to come teach this person. If it's your responsibility, you're going to do it, right? You're going to be able to say, okay, well, I'm learning and you're learning. It's okay for medical coders and doctors to learn at the same time, but it has to be you to be able to understand, okay, this about these guidelines and things like that, so that I can explain this to the doctor or the provider, so that they can understand how to make sure that they are compliant, because it's all about that, right? It's all about compliance and everything, and making sure that everything is properly on that paperwork. But again, guys, it's going to go back to toughening up. And if you say, well, I'm just going to do this with reckless abandon, I'm just going to just throw out there whatever, and not really being as direct like you should. If you see a job posting in a facility that you want, then you're going to write that on there in your professional objective, not your professional summary, because somebody like me, who has years of experience, 15 plus years already, would have a professional summary. You, as somebody new, would have a professional objective. What is your objective? What do you want? And if you have entry level, that you're seeking entry level anywhere on your resume or your cover letter, I implore you to get it off of there, because that's going to be the reason that yours hits that reject pile really quick. Because that says to the person looking at that you need your hand held. And they don't want to hold hands, guys. They don't. They want you to be able to know how to do your research. Yes, you're going to have questions. You're going to have things that you're not going to understand because you're brand new to the field. But at least if you can show some form of research, some form of, being able to sustain yourself and be able to find your own answers and do your own research, that's going to go a long way to helping you get hired, versus a person who's announcing to everybody, I need my hand held and I want a job right away. And I've been only applying at 2 or 3 places, or they're not looking for my credentials, so I can't apply. Really? Do you know that I've applied for a place before that wasn't specifically asking for the CCA and I still got the job? Why? Because I applied. And when I applied, I had on my resume all the things that qualified me for that particular position. And that's what got their attention. Okay, so she has all these other things. Okay, she has a CCA. Well, at the time I had my CCA. Now I have the CCS and the CCSP. At that time, it was a CCA. Well, we'll go ahead and give her a shot because she has all of the qualifications other than that we didn't specifically list this credential. So you can apply for places that they don't specifically list your credential. But again, just know that if you have completed a program and you have that on your resume, that you completed a program in medical billing and coding, and then when you go and they say, okay, well, we'll go ahead, and sometimes they'll say, we take education in lieu of experience. That's what that means, that you've been educated. So then they say, well, but we're going to expect you to get your certification within 6 months. Sometimes they'll say 6 months. Sometimes they'll say a year. Somebody told me that they had up to 2 years to get their certification. So if that's the case, then by all means, jump on that job if they want to hire you, and then get your certification so that you can fulfill those requirements, because that's the reason that they're hiring you. All right? And don't wait till the last minute to be trying to pass your certification exam. Study for 20 hours per week, like I always recommend, and that way you can be fully prepared. Guys, it takes effort, it takes work, and I do things the old-fashioned way. And the old-fashioned way has never failed me. Never once has it failed me. So taking the time to do your research about that facility and looking at the job listing and making sure that if you have the skills that they're listing on the job listing, make sure that it's on your resume. All right? And you can do it, guys. You can do it. If you say, oh, well, I'm not a good, everybody can write. Everybody can write. As we all know now, with text messaging and emails and things like that, we can all write. All right, guys? But again, if you want to farm it out, by all means, go ahead. There's a ton of resume writers on LinkedIn. But I do recommend getting somebody who has experience in the industry so that they know what employers are looking for. Because believe it or not, there's some professional resume writers that they have no clue, and it shows. It shows on those resumes, because I've had to redo one or a few before. I'm just saying. And again, I will be available again for bookings after August the 15th. So with that said, always be truthful on your resume and cover letter, and always make sure that you are deliberate in your approach. Make sure that they know what position that you are looking at applying for, right? And again, if you haven't got your certification yet, there is still time once you've completed your program to study, pick out the certification that you want, and go for it. And there's plenty of videos on my channel talking about those certifications. I'm just saying. So with that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like and subscribe, and I'll see y'all next time. Bye.